To do still technique of a lower thoracic vertebra, one, of course, first identifies the vertebra. As I do this, I notice a prominence of the transverse process on the right side, and this would be most likely T7 as it is just above the angle of the scapula. I'm going to diagnose while I am setting this up, and so I'm going to first introduce some right rotation and right side bending, and in flexion I actually sense that this somatic or this vertebral segment becomes freely mobile at that level. Because he's in flexion and knowing that I will eventually be putting him into extension, I'm going to change my hand hold such that I've got my hand holding the vertebral segment below the dysfunctional one. This will allow me to do anterior translation to achieve extension at the point when I need it. So starting again in the position of ease, I'm going to have him flexed, rotated right, side bent right. I have my right axilla over one shoulder, my hand on his opposite shoulder. I now introduce a compressive force from both shoulders, angling for that somatic dysfunction, trying to put relaxation into both facet capsules on either side. Now that I've achieved that, I'm going to introduce left rotation, left side bending, and finish with extension via anterior translation. And then, of course, one goes back and revisits to make sure that the somatic dysfunction is gone, and he does have free motion going into extension, which he could not do previously.